Welcome to this week's episode of Morning Report Emergency Medicine. I'm Alec Weir. This is the case of swing dancing. This case comes to us from one of our second years, Dr. Brandon Morchetti. We have a 46-year-old man. He's got no real past medical history, although he's recently diagnosed with diabetes, but not on any medications. He's coming in with a 1-month history of all these complaints: shortness of breath, chest pain, dry cough, nausea, vomiting, constipation, decreased PO intake, orthopnea, subjective weight loss. All right, you got all that? Here are his vitals. He's afebrile at 36.8. He's tachy at 120 and pretty tachypnic with a respiratory rate of 37. His blood pressure is 136/87, but he's satting well on room air. And it's one thing for me to read these to you. Let's take a look at him. Here he is on the monitor. We see our heart rate's in the 120s, satting well 100%, pretty tachypnic, but blood pressure's okay. So what do we have? Taking a look at the monitor, we have these difference in our elevations on our rhythm strip, okay? We've got high voltage and lower voltages, high voltage, lower voltages. You can actually even see it here in your pulse ox reading. And so, Dr. Morchetti, the astute clinician that he is, got the ultrasound on this patient. Here we have our parasternal long view, all right? Here's your left ventricle, your right ventricle, and then what's all this surrounding your heart? Well, this is this guy's massive pericardial effusion. It's so massive that we have tamponade, right? We're having collapse of our right ventricle during diastole. It looks like a man or a woman or some gender-neutral species jumping up and down on this right ventricle, okay? That's tamponade on your ultrasound. We have tamponade here. So let's take a look at the 12 lead. The differentiation in voltages isn't as apparent as it was on the monitor, but you can see we have a high voltage here, slightly lower voltages, back to high voltage, lower voltages, 2 high voltages in a row. So what do we have here? We have electrical alternans, which is actually pretty rare, and it's also much more rare to see that 1-to-1 high voltage, low voltage that we see in the textbooks. More commonly, when you have a patient with pericardial effusion, you'll just see low voltage on your EKG. Here's his x-ray. We have a generous cardiac silhouette. All right, matches with our picture, but we already knew that, right? Ultrasound took care of it for us. So what could have caused this pericardial effusion? Well, here's your differential. It could be viral, malignant, uremic in your kidney patients. It could be trauma, radiation, autoimmune, medication. And if that's not enough, we'll throw idiopathic in there just to cover our bases. So what do? Well, we got to relieve that fluid, right? We have tamponade. We've got 2 options for our pericardiocentesis. We can do it in the emergency department, or we can do it in the cath lab. And this delineation is usually done based on what's available at your shop and also how's the patient doing hemodynamically. And so if it has to be done in the emergency department, how are you going to do it? You can do it blind with a subxiphoid approach with your needle pointed at the patient's left shoulder. But we have the ultrasound, right? We used it for the diagnosis. Let's use it for the treatment. Use a subxiphoid view on your ultrasound, and you can watch that needle enter the pericardial sac. This patient's hospital stay, he had a drain placed on day 1, and it was done in the cath lab because his blood pressure was holding. He was doing well from a hemodynamic standpoint. Had a window done on day 5, and then he was found to have widespread metastatic renal cell carcinoma with mets to his lungs and his lymph nodes with that malignant effusion. So what are our take-home points? Use that ultrasound, right? We can diagnose tamponade with collapse of the right ventricle during diastole. Look at your EKG or at your monitor for electrical alternans, and then that chest x-ray with that generous cardiac silhouette. Now I will mention the physical exam for the purists, and also because it will be on a test. Beck's triad for pericardial tamponade. You're looking for distant heart sounds, JVD, and hypotension. Know your causes of your pericardial effusion: viral, malignant, uremic, traumatic, radiation or autoimmune, medication related, and of course, idiopathic. And then know how to treat it. You diagnosed it, treat it. You can either do it in the emergency department, either blind or with the ultrasound, or you can do it in the cath lab if the patient's hemodynamically stable. All right, guys, a great case from one of our second years. Keep your eyes out for more interesting cases. Thanks for listening.